So there's different types of probiotic strains in our food supply. And when it comes to heart health, we actually see in the research that there's two specific strains that help to reduce inflammation associated with heart health. If I asked you, hey, what do you think is the most ultra processed food? Most people will say junk food, Twinkies, like candy, things like that. But it's actually in a lot of our food products that are marketed to us as healthy. For instance, someone finds out they're diabetic. What do? They get rid of all the carbs in their diet. Then what happens? The next time they eat a carb, their body doesn't know what to do with it. So now it's going to raise blood sugar levels even more because you're not teaching your body how to work properly. You're removing the culprit. You're putting a Band-Aid. And I want to just emphasize being overweight, abdominal adiposity is a huge risk factor for heart disease. But heart disease happens in every body and shape. And so we need to be more proactive.
Welcome to the Performance Initiative Podcast.
Our goal is to provide you and ourselves with the tools to be the best versions of ourselves.
We are your hosts, Dr. Grant Cooper
and Dr. Zinovy Meyler. We just wrapped up a conversation with Michelle Routhenstein.
Michelle is a delight. She's a cardiology dietitian, a preventative cardiology nutritionist, registered dietitian, nutritionist, and certified diabetes educator. She really gets into a whole person approach using science-based nutrition. Michelle is passionate about not just caring for her patients in her practice, but providing online education and really getting the word out about how to have a cardiac healthy diet. I took away a lot of important information from this conversation.
Absolutely. It was very empowering about things that people can do in terms of prevention, utilizing nutrition for cardiovascular and just a whole body approach of how to prevent inflammation, inflammatory disorders, looking at this from the perspective of nutritional value, nutritional effects on inflammation, and how that impacts cardiovascular health.
And empowering is the word because there are so many takeaways about what you can actually implement within your own diet and put it into your life in a way that makes sense and works. So I think everyone's going to have a lot to take away from this. And importantly, the sooner you can start a cardiac healthy diet, the better.
Absolutely.
And B, a cardiac healthy diet really overlaps, almost completely with just an overall healthy anti-inflammatory diet. So this really is for everyone.
Absolutely.
Enjoy. Michelle, thank you so much for joining us today. We are really excited to talk to you. Cardiovascular disease is the number one cause of death in the world. And so getting to talk to an expert on nutrition for prevention and possibly treatment of cardiovascular disease is obviously really important, really exciting. We have a lot of topics within that we want to touch on, broad and smaller. We thought we would start with an age-old question, one that I know in my parents' house we've argued a fair amount about, and maybe other families have as well, and that is milk. Skim milk versus 2% versus whole milk. Where are we in thinking about what kinds of milk that we should be consuming in terms of the fat content?
Great question. So when we look at dairy, there's so much to be talked about within dairy because the question could be expanded to many different topics of should I be even eating dairy? But if we're talking about, hey, Michelle, what's the best dairy out of those three options? I would tell you that your skim milk is going to be the best for heart health. And that's because your 2% and your full fat dairy has more saturated fat in it. And we want to make sure that you're not having too much saturated fat because saturated fat can cause insulin resistance. It can cause the cells to be more insulin resistant. And it also can block the LDL receptors on the liver to actually break down LDL cholesterol, which can increase LDL levels. So if you're someone who tells me, Michelle, I like 2% more than skim milk or I like whole milk, it can fit in someone's diet as long as we're looking at the totality of saturated fat within the person's diet. But if you're just looking for a black and white answer, I would say skim. But as you'll learn from me, it's never just a yes or no. I'll always have comments because there's so much nuances, which is why when you look at the research, you're like, well, what's going on? When it comes to skim milk, it has no fat, right? And vitamin D is in our dairy products, which is one of the important nutrients that we need to absorb. And vitamin D is a fat-soluble vitamin. So if you just have a glass of skim milk by itself, you might not be getting the most effect from the vitamin D. Same with yogurt. If you're getting fat-free yogurt and you're having it by itself. But instead of necessarily increasing the saturated fat content from the dairy product, what if we added a heart healthy fat to the mix? Right. So if you're going to have yogurt and you put in 2 teaspoons of chia seeds or flax seeds or 10 walnuts, that's going to allow you to also absorb the vitamin D that's in your dairy products too, that is cardioprotective.
Nothing exists in a vacuum, and everything has to do with the context and the overall picture, of course. Just one side note or side question regarding milk. Do you have any opinion about beta casein A1 versus A2 in milk? How important is that to pay attention to, besides some people tolerating A2 a little better than A1?
I mean, it really is a personalized questions in the sense of like which one, if you have a dairy intolerance or if dairy makes you bloated, yes, one of them could those things can help, but both of them may also aggravate your stomach if it's a true dairy intolerance. So, um, a lot of products that kind of process it to show one versus the other, I'm not always a big fan because there is a lot of processing that has to go through that has to be done to the product to have those available. So that can also cause a little bit of inflammation, and we need to be mindful of that when it comes to heart health. There was a study a couple of years ago that showed individuals who are on vegan diets, plant-based diets, Mediterranean diets, for 5 years post a heart attack, a cardiovascular event. And they found that individuals, no matter what diet that they followed, depending on the amount of processing that was in their diet, that caused their cystatin C to rise, their inflammatory markers to rise. And that increased their risk of having another cardiovascular event within 5 years. So I say this because when we look at food and we look at the processing nature, if I asked you, hey, what do you think is the most ultra processed food? Most people will say junk food, Twinkies, like candy, things like that. But it's actually in a lot of our food products that are marketed to us as healthy. You can't make that separation at home. You have to use a huge machinery to do that. So is that causing, or is that a big picture of our ultra processed food market? Because in that study, ultra processed food is defined by the NOVA classification index. And that NOVA scale looks at the degree of processing, of how much heavy machinery do we use to extract certain elements in our food supply. And so we have to be careful with that, the marketing, and really realizing what's the best way for our body to utilize it and to keep inflammation down. So I'm not usually a fan of a lot of those milks that say, okay, we've ultra processed it or ultra filtered it to have this amount of A1 versus A2. I think that's too much processing in general that can lead to some underlying inflammation.
That's a really interesting. I never heard of the Nova score. It almost sounds like that should be something on all of the packaging. That you should know how processed your food is, because you're right. You think of Snickers or something like that as being the ultra processed.
Right. But the thing that I don't want people to get to the point where, you can't buy anything that's in a package or you can't buy anything that's convenient, because sometimes we need that. So by the definition, there's been a lot of talk in the medical field of defining the definition, because some foods that have good nutrients can also be ultra processed. So we need to do a little bit more of that fine tuning of what processed foods can lead to that.
It seems like the Nova scale is it's a really I never heard of it, and it sounds like something that would be really interesting to know on packaging, so that you would have a gauge of how processed is the food that I'm consuming.
Right.
Because there are probably a lot of foods that you wouldn't think of that immediately.
Yeah, exactly. But so when we look at the studies, they always use the NOVA scale. And so the ultra processed foods is defined on how processed it is. But we're trying to get more granular in terms of, okay, some things may be a little ultra processed. For instance, some hummuses can be ultra processed based off of the preservative they add to the hummus. But does the fiber, does the nutrients within the hummus off balance the processing elements? And so that research is kind of still
Sure.
coming up, because we see that you can't just lump all processed foods together. but it's still not fine-tuned. So right now, that scale really shows that anything that's using heavy machinery is classified in the group 4 category, defining being ultra processed.
Hey, can we back up to the milk for 1 second?
Yeah.
Because what you said is going to make my parents really happy and doesn't align with what I had my previous notion. So I'm ready to be converted. But I had always thought that skim milk, or not always, but I thought that the consensus had drifted to think that because skim milk maybe has more sugars or doesn't have the satiating effect of the fat in it, that it was actually somewhat better to have like a 2%, because that makes you feel more full. So you end up maybe drinking overall less or eating less. Is that outdated? Basically, more saturated fat means bad, and we should be just looking to try to get our fats from healthier places?
Yeah, so exactly. But there's a truth point to that as well as the satiating factor. Fat is satiating, and I don't want you not to have no fat in your diet, but the balance matters. So the example of taking your dairy and now adding a little bit of fat, making sure you have fiber in that meal as well, the balance of your macronutrients is going to give you the nutrients you need, allow your body to absorb those nutrients effectively and cause you to be satiated. So I'm not saying go eat a cup of skim milk. That's not really a balanced component to your diet. It's really about how are you utilizing it? Are you putting skim milk in your smoothie and now you're adding in fresh fruit and vegetables and heart healthy
Mhm.
fat to make it more balanced and more protein? I wouldn't like we in the olden, back in, a while ago, they used to teach your plate should have a cup of skim milk with it. And now we realize you can get calcium from other places. You can get these nutrients, but you need to just look at your entire diet and make sure that you're getting it from other places. I mean, as a kind of off but related, I have clients who come to me who are vegan. I have clients who come to me who eat both animal and plant-based products, and I have people who, all different types of diets. And even if people come to me and they are vegan or they're animal based, whatever they all describe their diet differently because we as humans eat differently based of our culture, based of convenience, based of all of these things. And at the end of the day, when you look at it from a heart health perspective and you look at the dietary indexes of inflammation and heart health, we're really all the time looking at nutrient sufficiency. If you can have a heart healthy vegan diet, or you can have a very unhealthy heart healthy
Yeah.
unhealthy vegan diet. You can have a healthy Mediterranean diet or an unhealthy Mediterranean diet. The Just because you're labeling a diet as one sort, what you are actually eating and the nutrients that compose of it make a big difference in terms of actually preventing future cardiovascular events. And this is the big thing. So if someone comes to me and says, I love my whole milk and that's a non-negotiable, okay, we will figure that out within your whole entire diet to include it. So it's not that everyone needs to be on a skim milk, or someone might say, I hate dairy, makes me bloated. It makes me constipated. It makes me have diarrhea, whatever it might be. You know what? Dairy might not be a good thing for your body. So now we can take it out, but we need to make sure that when we are removing something, what are we replacing for those nutrients? Where are you getting your calcium? Where are you getting your vitamin D? Because we can't just remove. We need to understand, well, what nutrient gaps are now going to be apparent in my diet, and how do we make sure that we're going to fulfill them? And so that's why the personalization of all of this is really helpful in making sure someone is successful. Because, like you mentioned, you have an argument with your parents. So if your family is like, I want to have skim milk, and you're like, oh, I want to have whole milk. Okay, we can make that work based off of what like, but we
No,
need to
no,
just adjust.
right. This is a good pivot point to what is a heart healthy? Can
Well,
we?
right. Well, so for one, there are kind of two questions, right? So two questions. One of which is something that I think we're all on the same page about, but it bears to repeat it and to make sure that this is vocalized, and that is, just before we started recording, you had mentioned some of the clients that you have that have heart attacks or heart failure. But at which point should we talk about implementing a heart healthy diet? At which point in life do we wait for a cardiac event? Do we, or is this something that we need to worry about earlier on?
So we see over and over again in the research that as soon as you intervene, the more successful you are. So wherever you are, you want to make sure that you are implementing a heart healthy diet for the future. I think a lot of times people don't feel like it applies to them until someone close to them has a cardiovascular event, or if they know they have a strong family history and they're starting to get around the age of when something happened to their parent, and that's kind of when they take action. But the best way to assess is to really do a good cardiometabolic risk assessment, right? If you start seeing that your LDL is increasing, if you're starting to see that your blood sugar levels are increasing, if you're starting to see your blood pressure levels increasing, or you're going to the doctor and you have high blood pressure in the office and you choke it up to say, oh, it's just white coat syndrome. Well, you need to check your blood pressure at home. If you have a strong family history of heart disease, you want to make sure that you're taking action as soon as possible. And if you have family, if you've had a cardiovascular event, you want to be very proactive to avoid another one as soon as possible, but also to teach your loved ones of, okay, this happened to me, but it can be genetic. I mean, I always tell people a lot of times very young individuals come to see me after a heart attack in their 30s. And they say to me, Michelle, nobody looked at my genetic predispositions. No one looked at anything, even though I have a strong family history. And because I'm young, I'm fit, I'm athletic, they kind of just, told me I'm okay. And I want to just emphasize being overweight, abdominal adiposity is a huge risk factor for heart disease, but heart disease happens in every body and shape. And so we need to be more proactive. If you're wondering, I don't know my family history, or I don't know if I have any of that, there are many genetic markers that can help us assess it. But one simple lab test can help you, and that's called lipoprotein A. And if that level is elevated, you want to make sure that your cardiometabolic risk factors are even lower than the general population, because you have genes that can be turned on that can definitely cause earlier cardiovascular events. And just to kind of emphasize, so one of the leading causes of heart attacks and strokes is atherosclerosis, that plaque formation in the arteries. And when we've seen kids as young as 8 have autopsies, we've seen plaque formation in 8-year-olds. It starts early in life and it doesn't really surface until later, depending on your genetics, depending on the circumstances. So the earlier you intervene, the better it's going to be to reduce your risk. But with that said, wherever you are now, we can't go back, but we can start today. And that's really important to take note and to make sure that we're addressing all of these factors.
Yeah, those are great points. And then on top of that, I would say because it starts so early and because it is sort of a silent, a silent killer in the sense that you don't necessarily have any symptoms in the beginning, it's a lot easier to start habits as soon as, the sooner you get into better habits, the easier that is to continue. And so ideally, I would think that everyone wants to have a heart healthy diet from jump as much as possible, right? And within reason and within fitting within lifestyle and all of that. But still, it seems like everyone would benefit from it, I would
Yeah,
think.
and one of the things to probably emphasize is that we talk about heart healthy diet, but when we talk about cardiovascular, a lot of the times we leave out the vascular component of this. And even though we say heart and stroke potentially, but it's everything vascular, which includes erectile dysfunction, peripheral vascular disease in the extremities, and et cetera, et cetera, et cetera. So it's a whole body, whole body health, not just heart health. And I think the point is driven home when someone actually looks at the vasculature of the body. And I think it's very easy to see in one of those bodies exhibits, and forget about the ethical questions of how those bodies are sourced and so on and so forth. But if you see how much vasculature there is in the body, then whenever we talk about the heart healthy diet, we're really talking about all the vasculature that supplies everything in our body.
And I'm so happy you said that, because plaque can form in any artery. We have veins that go to all of our arteries, right? So when we talk about heart health, we're talking about brain health, we're talking about kidney health, we're talking about pancreas, we're talking about gut health, we're talking about everything. Because if you don't have good blood flow and you don't have good blood supply to those organs, they're not going to work optimally. And so we need to always think of that, and most people don't. And so when we talk about reducing that plaque and that narrowing in the arteries, we're really talking about the blood flow to all of our organs. And you mentioned erectile dysfunction. And I want to mention this because there's so many people when no one talks about certain things. It's kind of like, oh, I don't want anyone to know. And they kind of sometimes even joke, oh, yeah, I'm just getting older. But that's one of the biggest, earliest signs of atherosclerosis. And most people don't realize that. And when you go back into someone's history, they're like, oh, yeah, that started 15 years ago or 10 years ago before my heart attack. And so don't ignore that. There's signs. Your body is telling you a lot of things, and we need to listen to it. There was a recent report from the Journal of College of the Academy of Cardiology that said that the global burden of cardiovascular disease is still the number one cause of death worldwide and burden and all these things. And it said the number one attributable risk factor was from high blood pressure and obesity. But high blood pressure is often so neglected because people chalk it off like, okay, you're nervous. You're in the doctor's office. You're wearing a white coat. I'm wearing a white coat. You're nervous. And so it's a little bit high. Don't worry. A year goes by and it's trending up, but they're like, don't worry, don't worry. And they say, don't worry because they don't, with medical guidelines, they're not going to medicate you until your blood pressure is a certain level. And if it's above 120/80, you need to take that seriously and get that to be lowered. We've seen research that shows high blood pressure and atherosclerosis are very hand in hand. You can have high blood pressure that leads to plaque formation in the arteries, and it doesn't need to be a very high blood pressure. 130/80 can cause structural changes in the arteries, and we need to be paying attention to our blood pressure more than ever. And just checking it once at a doctor's appointment, not enough. We really need to be monitoring that at home.
Sorry. There's just one thing that I remember back from medical school when a pathologist actually had posed a question to the class and said, if you have a patient who has elevated blood pressure and is a smoker, and unfortunately you can only address one thing, do you have them stop smoking or do you address their blood pressure? And the reason that he posed that question was to drive home the point of, he says, blood pressure, because they're not smoking when they're asleep, that their blood pressure is bombarding them 24/7. And so blood pressure is completely detrimental to us. And even, like you said, slightly elevated blood pressure can be mechanical strain for the vasculature. And that in itself can increase some of the vascular wall injury, which causes plaque formation and so on and so forth.
Yeah.
Exactly. But
I think
also
people
your
don't realize
arteries
how much diet can play a role in this, right? It's really something that is in a lot of our own control with what we eat, also exercise, but nutrition is huge. Yeah.
Oh, 100%. And blood pressure responds very well to nutrition. Because when your arteries are constricted, if we can optimize certain pathways like the nitric oxide pathway, making sure we're giving food that helps to open up the arteries, reduce tension in the arteries, that's going to help with better blood flow. So a lot of times people will say, "Oh, my doctor just told me low sodium. I'm on no salt. I'm on a low sodium diet, but my blood pressure is still elevated." It's like, well, you're not getting the actual nutrition that you need to help open them up and allow for better blood flow. And I like to give that really drive home the importance of blood pressure by just explaining what's going on. If your blood pressure is high, what's happening? Your arteries are constricting. If your arteries are constricting all the time, what do you think is happening to your heart? Your heart has to work harder to pump blood throughout the body. And most people think, okay, I don't want to have a heart attack or all these things. But we don't realize that when your heart is overworking, it's going to enlarge. It's going to reach to a point where it can't do its job anymore, which leads to heart failure. And heart failure has a very poor prognosis if we don't address it timely. If we address it timely, we can avoid that. When you have high blood pressure, it also can cause an aortic dilation, which could cause a bulge and a rupture of a big artery. We don't want that. It's important that blood pressure is taken seriously as soon as it's starting to rise. And we can do that through nutrition, and medication is necessary, but we need to monitor it. And that's the first step.
Friends, we hope you're finding value in the content. If you're enjoying what you're watching, please consider hitting the like button, help us with our YouTube algorithm, consider subscribing to the channel, and turn on the notification button to stay up to date with everything going on in the channel. How important is sodium when it comes to blood pressure? I hear conflicting thoughts on that? Is a low sodium diet something that's important for a heart healthy diet, particularly for blood pressure?
Yes. So sodium, but this is the thing where people get confused. Many people think of all or nothing, and that is what trips many people off. You don't want a no salt diet. You actually can't technically have a no salt diet because there is sodium in a lot of our natural foods that we are eating. But you don't want a no sodium diet. You don't want no added salt, but you don't want a high salt diet. So if you stay between 1,500 milligrams and 2,000 milligrams a day, you're going to be in the window of where your body can utilize the sodium and be fine with it. But people are eating 5,000, 6,000, 7,000 milligrams a day. That is way too much, especially because we know that sodium can cause endothelial dysfunction, can cause a tear in the artery wall, can cause our arteries to constrict. So we don't want a no salt diet. We don't want a high sodium diet. We want the right amount. And to give a reference point, 1 teaspoon of salt is 2,300 milligrams of sodium. So a pinch here, a pinch there, you can go up that pretty quickly.
Pretty quickly. So here again, I guess I went to medical school decades ago now, and so I'm feeling like my thoughts on these have become outdated, which is why this is a great conversation for me in particular. But I had thought that there were certain people, like a subgroup of people with high blood pressure, that were particularly salt sensitive, and that for everyone else, it was basically the kidneys kind of handled the salt, and within reason, you didn't have to worry about sodium so much. Is that completely outmoded? Is it just a matter of degree? Did
Yes.
I just sleep through that part of the class?
No, so there is a subgroup of people who are salt sensitive. And those individuals, when they have salt, and this could be just a little bit of salt, they can get bloated. They can go up 2 pounds on the scale. They can they can get fluid retention. They will have a headache. They'll be more sensitive to the response of sodium. But in the majority of people, there's so much threshold your kidneys can utilize. And a lot of times, because high blood pressure is not addressed timely, the kidney function is not where it should be. So now you're adding more pressure on your kidneys. And the number one cause of kidney failure is high blood pressure. So, yes, the sodium cannot be as much as you want because you're making your kidneys overwork. And when your kidneys can't compensate anymore, it leads to kidney failure. We don't want to overburden any organ of our body, which is why it's so important that we're giving the nutrient it needs in the right dosage so it could do its job and it can continue doing its job for the rest of your life without any failures, without any impacts to damage any of our organs. So everybody should not be having as much sodium as they want. It needs to be in small dosages so our body can handle it, our kidneys can handle it, it can regulate it, and it doesn't have a negative effect on any organs of our body.
Something that's worth mentioning too, I think, is that a lot of times when you reduce the salt or any flavor, right, at first it's difficult, but your body, you acclimate to whatever the new taste is. And then, if you get used to low salt, then you don't feel like you're missing the salt after a while, but you have to get to that point.
So that's because people do extremes and we need to do things gentle. Our bodies like gentle care. So, yeah, if you were on a very high salt diet and then you just took out the salt, you'd be like, this tastes like nothing. There's no flavor because the taste buds are used to that amount of salt. It takes 2 weeks for you to get kind of new taste buds to to, make sure that it feels better
Right, to
on
get
your
comfortable
body.
with it.
It's the word. But I want to make sure that when you are reducing it, what are you replacing it with? A heart healthy diet should not be bland. I love food. I will not eat food that doesn't taste good. It's just not going to happen. And I follow a heart healthy diet because I feel really good when I am. And, it's important to do that. But you need to make sure that you're
Yeah.
replacing it with. So if you're someone who used the salt shaker, if you use someone who had a lot of salt as part of your flavoring, what are you going to change that to? Are you going to use garlic powder, oregano, paprika, cumin? What are you going to replace it with? You can't just remove it without substituting something in because you're not going to enjoy it. And if food isn't enjoyable, it's not going to be a long-term strategy. And when we talk about heart health, short fixes don't work. Fad diets don't work. It actually puts more pressure on our heart. We want to do things that we're looking at to create habits for the long haul because in order to protect your heart, this needs to be a lifestyle. It's not going to be a quick fix, get your numbers normal, and then then go back where you were before. We need to build in these habits for a lifelong time.
So, you'd mentioned a number of very important things that I don't even know where to start, but I think one of the important things that you said is that it takes 2 weeks as an approximate time frame to change the taste buds, to acclimate to the new way of eating. And I think those time frames are very, very helpful for clients, for patients, because it's very frustrating for someone to make a change and not see an immediate, of course, change, or some kind of an expected result. And if someone knows, so there are a number of different either supplements or certain treatments that when we provide, we always try to tell people to say, well, you have to commit to it for 2 months or a month or whatever that may be, so that they know not to get frustrated and kind of fall off the bandwagon. So when you're making these changes, and of course, there's not going to be a singular time frame that you can give, but what are you looking at in terms of time frame, so that when someone does institute a change, they know that, okay, I need to stay consistent, and I may be able to see a change in a month, in 2 or 3.
So it really
So what,
depends
what,
on.
what are the time frames that you usually give your client?
Go ahead.
So usually there are many things that they're trying to achieve. So it'll be dependent on the goals. When I see all my clients, we do a very thorough 90-minute evaluation, and that helps me prioritize what are we going to start with? What do we need to start with in order to be successful? If someone's trying to lower blood pressure, I want to see a reduction within 2 to 3 weeks. So we have to monitor your blood pressure on a regular basis to assess that trend. And I'm there to make tweaks and make that happen. But the biggest change that happens much quicker than any blood test or any blood pressure would be energy levels. A lot of my clients will say, I thought I was just getting older. Now that I'm actually eating all these nutritious foods, within a week, I have more energy. I feel better. I look better. And that's really the first sign that things are going in the right direction. And then when they're consistent, blood pressure, I like to see 5, 10, 15 point drop within 3 to 4 weeks. And with cholesterol, I like to see it in 3 months. With blood pressure, hemoglobin A1C, I like to see that within 3 months. With inflammatory markers, I like to see a trend downwards within 3 months. So it really depends on where they're starting, and that's going to assess like a good progress point. But I do want to see a 30, 40 point drop in LDL cholesterol, ApoB levels within 3 to 4 months using the diet. One of the things I
Pretty
do
fast.
work with and one of the things I do work with a lot of my clients is improving gut health, because in order to excrete LDL cholesterol, you need to have an effective bowel movement. And so a lot of times when I'll speak with the client in the initial part, they'll say, you know what, I'm regular. Regular to you, right? No one talks about what's the best bowel movement. That's not a conversation, but it should be, because heart health and bowel health are very connected. It mind boggles me that doctors don't talk about bowel movements more. But anyway, that's a side note. So we talk about that, and they go, yeah, I'm regular. That's probably 9 out of 10 people. They'll say, yeah, I'm regular. I'm like, okay, good. I'm like, pay attention to it though. I know you said you're regular. Pay attention to it. When you start telling me, oh, wow, things have changed, that's my notion that we've changed the gut microbiome, whether we've added more probiotics, prebiotics, whether we add more soluble or insoluble fiber, everything's going to tweak a little bit. But when we see a change in a bowel movement to more of like a Bristol stool chart type 4 on a consistent basis, my clients recognize that. And that's when I'll put like a mark on their calendar and say, check your LDL cholesterol in 3 months. This is how I know how effectively the cholesterol will be, what diet is doing to your cholesterol levels. And that's when we see the biggest impact, because that's the only way you can excrete it, right? That's how we excrete LDL cholesterol. If we want to prevent its production, there's other things we need to limit in our diet, but I really want to see good bowel movements. So that's also another indication.
What is a Bristol type 3, did you say? Bowel
Type
movement? What does
4.
that mean? Type 4,
So it
sorry.
yeah, so it's a stool chart that basically shows there's type 1, type 2, which is more constipation. There's type 6 and 7, which is more malabsorption. Something's irritating the gut, you're kind of having more diarrhea. And you have a 3, then you have a 3 or a 5. And then a 3 or 5 usually means there's some not enough insoluble or not enough soluble, depending on the type. And type 4 is kind of like a snake-like bowel movement that helps with that's easy to pass, that's a little voluminous in nature that helps you go naturally. If someone has to take laxatives or their morning coffee to go, it means that your body is not pulling the cholesterol out like we want it to. So that's an important sign. Um, Also, I always check waist circumference in my clients. And if that's above 35 inches in a woman or above 40 inches in a male, we monitor that on a weekly basis. And I like to see about an eighth of an inch decrease every week. Hard to always kind of assess that because it's just a small amount. But over 2, 3 weeks, you should see half an inch come down, an inch come down if that's one of our goals. And that's a sign to me that we are also tackling insulin resistance and inflammation without blood tests. So I look at several things depending on the client's goals, the client's risk factors, and we monitor them because if things aren't moving in that direction, that to me means we need to change something up. We need to pivot. We need to make sure that we are implementing change effectively to see good long-term results.
On a general basis, when you think of a cardiac healthy diet, is that basically what comes to mind is lots of fruits and vegetables, maybe some fish for protein, and good fats. Is that essentially is there something very distinctive from a heart healthy diet from an anti-inflammatory diet? Are these is it you know what I mean? Are they kind of one and the same?
They are, but I always find that when you say like, "Oh, fruits, vegetables, fish," how often? How much? How frequent? Is it around exercise? There's so many nuances that need to go into it. But yes, a heart healthy diet needs to also be one that addresses insulin resistance, addresses inflammation, and looks at all of this. And fruits, vegetables, fish will do that, but we need to make sure you're getting adequate protein. We also make sure that you're getting adequate whole grains and complex carbohydrates. And we need to make sure you're getting all of the nutrients your body needs. So there is research on a dietary scale called the Dietary Inflammatory Index, and it actually looks at all the nutrients, and it shows, how much are you actually getting to provide inflammation? How much quercetin are you getting? How much B6? How much vitamin D? All the nutrients that your body needs to help tackle the inflammatory pathways. So that's why while all those categories are important, within those categories, which one, right? Like if we're talking about
Mhm.
fish, someone could say, yeah, I eat fish, but they could be eating tilapia and flounder. Those don't have any omega 3s in it. So are you getting the anti-inflammatory component of fish? Not really. So I wish it
It's
was
very
as simple as,
yeah.
like there's so many people. I would say every majority of people who call me and ask to work with me, they're like, Michelle, I don't know why I have a heart issue. I eat really well. I don't eat processed foods. And when I go into the nitty gritties of their diet, they're not getting enough nutrients. They're not getting the nutrients their body needs. And
I didn't
that's
know
where
tilapia didn't have omega 3s. Did you know
I'm not a fish eater, so
that? That's disappointing. When it comes to the nutrients, you mentioned nitric oxide before, and I see nitric oxide supplements being advertised all over the place, it seems. Is that something you recommend, or are there supplements in general that you think are that people should be taking?
Great question. So I'm a very food first practitioner, and I'll tell you why. The supplement industry is unfortunately not really regulated. So we don't really know what's in every single product. You have to also realize that we're taking out certain nutrients and putting it in a pill. Most people, it's interesting. A lot of people come to me thinking, they're like, I don't want to start a statin, but then they're on 30 supplements. And I'm like, like that doesn't really like, they're not a natural product. Everyone thinks that supplements are natural because it says vitamin, and they're not. They're made in a synthetic lab. So we don't know what's actually in them. And consumer labs have done a lot of third-party testing on many products. They found arsenic and lead and all of these things in them that we don't really know what's in it. And we also don't, it's not in the whole food matrix. So when you talk about nitric oxide is a pathway that helps to open up our arteries. And we see that individuals who have high calcium scores, high plaque formation in their arteries, have very low nitric oxide levels. But you can optimize this pathway by making sure you have enough vitamin C, enough folate, enough L-arginine, enough L-citrulline, enough nitric oxide rich foods that will help. But all of these foods don't just have nitric oxide in them, right? For instance, beets. Beets are very high in nitric oxide, wonderful food for heart health. But they also have potassium, they also have fiber, they also have folate. They have so many other nutrients that work synergistically in our bodies for optimal absorption and for optimal utilization. So I would much rather you get it from food than to take a pill. You cannot, there's been no study that showed that taking a pill will actually benefit cardiovascular health and function. But now you're asking your liver and your kidneys to process that pill, and you're putting more stress on your body. So in general sense, I'm not a supplement pusher. I really believe in food first because we see that in the research and we see that in how our body operates. But there are certain situations where supplements are needed, right? If you tell me, Michelle, I don't eat fish, for instance, you mentioned you're not a fish eater. Well, where are you getting your omega-3s? You can't get your omega-3s from flax seeds, chia seeds, and walnuts because it's a different type, right? Those are your alpha linoleic acid, your plant form of omega-3s. Only 5% can be converted into EPA and DHA. There's no way you can eat that many walnuts to get to your EPA and DHA requirements. So you may need a supplement. So in certain situations, there needs to be supplementation. If you're taking certain medication that's going to reduce certain levels in your body, like statins, you may need a CoQ10 supplement. But the type, what things are in the supplement matter, because some things can increase your LDL cholesterol. Some CoQ10s have medium chain triglycerides, which are a form of saturated fat. So there's a lot of nuances between it, which is why if you're going to go on supplements, you need that to be really looked at through with your medications. It needs to be looked at through what you're eating in your diet, what you're avoiding to help fill in gaps, but it's never going to replace food because it simply can't.
Yeah.
The supplements are actually surprisingly high. Let's say DHA. The ratios need to be correct, right? And also the supplementation. Any studies that have looked at the cardiac health with the supplement alone looked at 2 grams to 4 gram supplementation per day, which is way higher than most supplements out there. So when people are taking them, it could be providing a false sense of security, which is in itself can be detrimental.
And if you take too much, I've read that can cause atrial fibrillation, or at least contribute to that as well, right? So you have to. There's a balance that you know.
You had mentioned this a couple of times, and I don't think that we shouldn't dive a little bit deeper into this. The insulin resistance, and we've had a chance to talk to several dietitians, and it seems that surprisingly, there's not a clear consensus on insulin resistance and paying attention to that unless someone is a diabetic. And so it seems a little counterintuitive with all the recent research talking about how important insulin resistance is in terms of everything. I'm going to leave it there so that you can go a little bit deeper into it.
Yep. So someone could be insulin resistant 5 to 10 years before diabetes happens. Why? What is insulin resistance? And I think this will bring a little color to the picture. Your body is having a hard time processing carbs and utilizing the carbohydrates, which are the primary fuel of the brain. And so when you give that to your body, your pancreas is now over pumping insulin to help bring the glucose, the blood sugar, into the cell. When it simply can't overpump more insulin into the body, that's when blood sugar starts creeping up and leading to prediabetes and type 2 diabetes. It happens much earlier because our body compensates. It works hard, until it can't work anymore. And that's when we start seeing heart failure and kidney failure and diabetes. It's the later stages of our body just unable to work to do it anymore. And we see in the research that more than 70% of people who are insulin resistant have heart attacks. And so we know that there is a lot of contribution to insulin resistance wreaking havoc in the bloodstream, right? If insulin levels are high, we have more free fatty acid breakdown, we have higher triglyceride levels, we have a lot of that in the bloodstream leading to more plaque to form in the arteries as well. So we must address it. There are preventative tests to assess if you are insulin resistant, like the LPIR or the HOMA-IR or fasting insulin levels. It's not traditionally done in conventional medicine because it's more of a treatment model in conventional medicine versus a preventative model, which is why you see that on a routine exam. But I do encourage my clients to get it. But there's also signs that are very apparent when someone's insulin resistant. If someone has high uric acid levels, high triglycerides, they have fatty liver disease, they have abdominal adiposity, they have a hard time losing abdominal weight. Those are all signs to me that, okay, we need to tackle insulin resistance, whether we have that blood marker or we don't, because it's either there or it's brewing and we need to address it timely.
And so you talked about this in the context of inflammation, and I think it's important to know that inflammation is important in vascular health because the inflammation causes intra the endothelial damage, and then that can promote plaque formation, and that's why we care about the inflammation in the body, and that's why it comes up so much as we're talking about this. So would you say that it's important for someone who's not diabetic, who's not pre-diabetic, who hasn't thought about diabetes at all, to pay attention to glycemic index, to glycemic load?
Yeah. Yeah, definitely. So your body can only process so much at one time. So the way that you are eating and the pairing of your foods is going to allow for better utilization and better metabolism of those foods so that it can go into the cell where it belongs instead of lingering in the bloodstream where it causes havoc. One other comment though, you mentioned inflammation, and yes, it contributes to more plaque formation. But people who have plaque in their arteries, whether they know about it or they don't know about it, if you have inflammation, that's going to cause more chance of blood clotting and more ability for it to become unstable and rupture and lead to a cardiovascular event. So, inflammation is really important for the prevention on any spectrum of cardiovascular disease.
Great, 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 great. So when
Oh, can I ask a quick question about that,
yeah, yeah.
actually? When it comes to thinking about the response to insulin, obviously we're thinking about sugars, right? Do we? How do you feel about artificial sugars and artificial sweeteners? Do those mess up your insulin response? Should people lean into them if they just need something sweet, or should they stick to regular sugar or just avoid all of it altogether at all costs?
Really that black and white. There are some studies that show that artificial sweeteners may actually lead to more insulin resistance, and other studies that show that it can help facilitate weight loss in certain individuals if they have a very high sugar need. So I'm always about, where are you in the artificial sweetener spectrum? Are you having a lot of artificial sweeteners? Are you having a small amount? And can we titrate it back a little bit? It might not be the first priority if there's other things in the diet that can be improved, and that's something that someone really enjoys. I think it needs to be a personalized approach because it matters in how the dosage, and it also
Mm.
matters in the person's reaction to it and what else we need to prioritize. A lot of times people will say to me, no, I like, this is whatever sweet and low in my, or my stevia in my coffee is like a non-negotiable. So I say, okay, like we need to, I don't want to take, I'm not about taking things away and decreasing quality of life. I want to meet you where you are and then say, okay, you know what? Can we reduce it a little bit? If you're at 3 packets, can we bring it down to two? Can we see how that feels? Can we add in a little bit more of this? Can we sweeten it with a little bit of this? And we work with it to happen, because it's really hard to go from having something a lot and then going to nothing. Your body's not used to it. And because artificial sweeteners are so cloyingly sweet, it's going to take some adjustment. And I think that a lot of people are set up to failure if someone says you have to remove all of these foods. It needs to be done in a certain gentle way in order for it to actually stick and for someone to feel good in the process.
It sounds like, as a general thought there, it sounds like artificial sweeteners, not the best, not the worst, not the highest priority thing, but if we can just titrate down, then use common sense, that would be good.
Yeah, I mean, there are some more studies showing that like certain artificial sweeteners destroy the good bacteria in the gut. So sometimes even just switching the artificial sweeteners can be effective and helpful. Also, seeing how the artificial sweetener plays a role in your diet choices. Some people who take artificial sweeteners crave sugar later in the day because their body's really smart. And they're like, hey, I had something sweet, but no calories showed up for it. So now they crave
Mm.
something sweet. And so then they crave the dessert. They crave something that has sugar in it because their body is talking to them. Your body is really intuitively smart. And in those cases, it might be a top or a higher priority. In other people, they have a little bit of stevia in their protein powder or whatever it might be, and they don't crave sugar and they feel good. And to really be on top of that when it's a low hanging fruit is is minute. So I have to look at the whole entire picture. But generally speaking, it's not the highest. Oh no, this is going to be damaging. But we're seeing more and more research showing that we don't want the dose is it's in the dose that you're consuming it in.
Yeah. And you mentioned that there are specific ones that have been implicated in their effect on microbiome. Could you tell us what those are?
Yeah, so we have a couple of studies on Splenda showing that it can reduce sweet and low, and Splenda can reduce the good gut bacteria in the gut. So I like to get a lot of individuals off of those and go for more of a pure stevia if that's something that someone's attuned to and happy with.
Because that goes back to what you said about bowel movements, right? And just microbiome has been implicated in so many different things at this point that avoiding that just seems to make sense in their overall health.
Yeah.
Yeah. Yeah, so I mean, some people get an osmotic pool with artificial sweeteners leading to diarrhea. We don't want that. We want a bowel movement where your body is doing the work. Yeah.
Can we transition a little?
Mhm.
Can we ask you about the new medications, Ozempic, Manjaro, Wegovy? How does that? They're obviously talked about a lot. It's not in our field of study, so we're learning about it with everyone else. How does that affect diets and dietary recommendations, nutrition, etc.?
So I know I keep giving you the same answer, but everything is just so personalized. And I say that because someone who may be struggling with obesity for a while and have tried diets, have tried all these things, and they're struggling, these drugs can really be helpful in helping them to lose weight. But I say this with caution in the sense that I want to make sure you feel good on the drug. I don't want you to be taking a drug, but you're constantly having diarrhea, or you're constantly constipated, or you're constantly fatigued, or there's something that a side effect that your body's not accepting the drug. So I've seen individuals who are on these drugs and they still adapt to a good nutrition because you still need those nutrients through your food, and they do very well on it. But I've also seen a lot of people who lose their appetite, who can't eat a lot, and they lose a lot of muscle loss. So if you're on these drugs, it's important that you are also looking into making sure that we are keeping your muscle mass with resistance exercise, adequate amounts of protein, and that you're eating a nutrient sufficient diet. So, any drug that you're on needs to always be complemented with nutrition. I can't tell you how many times people have heart attacks that come to see me and they've been on a statin for 15 years. They've been on these drugs for 15 years. They're like, I was on a statin. My LDL wasn't even that high. I don't understand how this happened. And I'm like, but you didn't pay attention to nutrition. They're like, I didn't think I had to. My numbers were good. We need to be what we're eating is really important for our blood vessel health, for our body to do its job more effectively, for it to thrive. So I go to cardiovascular conferences all the time, and I'm usually the only dietitian there. And doctors come to me and they're like, why are you here? You're a dietitian. And I was like, if you actually pay attention to the way that drugs work, they're all biological mechanisms of how the body works and what we're doing to either turn something on, turn something off to help. And if you look really closely, all of them require certain nutrients to fulfill those pathways. And so nutrition is so paramount to anything that you do, and it needs to be coupled with any drug that someone goes on. So nutrition can always support, drugs can always support your health goals, but you need to pair nutrition with it in order for it to be most effective. So they can be very life-saving. There's been a lot of great studies showing that individuals who were obese went on this drug improve their cardiometabolic risk factors. They've lost weight. They have good numbers on their lipid panels. Everything looks good. But we need to assess how your body is responding to it. And it's not something that everybody needs. It can work in certain situations to help support someone's goals.
Those are such great points.
Yeah, and you mentioned something that definitely worries us when we see patients go on these medications, and that is that they were implicated in muscle mass loss, and especially for patients that are for anyone that is aging and losing muscle mass is critical because it's much harder to gain that muscle mass back. And so you mentioned the resistance exercise, crucial, and then sufficient protein intake. So I'm curious what your recommendations are for sufficient. What constitutes a sufficient protein intake?
Yeah. So depending on the age, depending on their physical activity, I like to do around 1 to 1.2 grams per kilogram. You'll see some people saying 1 to 1.2 grams per pound, which is double that. That's a lot of pressure on your kidneys. We see some studies that actually show a very high protein diet can cause heart failure. So the dose matters. We only can really absorb 30 to 40 grams of protein per sitting. So we need to be mindful of that, especially as we're intaking it. And a lot of people who are only concentrating on protein usually miss out on the other macronutrients that your body needs, like complex carbohydrates and heart healthy fats. So you need to balance it appropriately for proper utilization. But 1 to 1.2 grams per kilogram is usually a general sense. If someone has some kidney failure, it would be on a smaller range. It would be a little bit less, but that's typically how I assess it.
What's your take on supplementing with protein shakes for people like this?
So it's a good so it depends what you're eating. If you're going to actually eat good quality protein, that's going to be a much better source because you're going to get a lot of other nutrients. It's not processed. Protein supplements are a supplement. They go into the same category as supplement. They can supplement a diet, but it can't be your only source of protein. I want a lot of my clients will do protein shakes and protein powders. It's perfectly okay, but you can add in a lot of protein into your diet in the natural form, and that's going to give you a lot more nutrients as well.
How do you feel about the carnivore diet? Because you hear some, from an anecdotal perspective, there's all sorts of people that swear by it, and yet it doesn't, it's hard to reconcile that sometimes with all the other things we know about nutrition. How, how do you think about it?
So I don't support the carnivore diet for heart health. And I'll tell you one main reason. If you're eating that much meat, you're eating a lot of choline and L-carnitine. And when we eat those two foods, our gut creates a metabolite called TMA, and our liver makes that into TMAO. And TMAO makes our arteries stiff and it creates plaque formation in our arteries. So you're setting yourself up for a heart attack. And, some people will be like, oh, look at my LDL, or, oh, those people usually say cholesterol doesn't matter. If you look at the research, LDL cholesterol is so imperative to the relationship between that and atherosclerosis. We need to keep that number in optimal ranges. And it's super important that we don't add fuel to the fire. The other thing is, are you having regular bowel movements on a carnivore diet? Probably you're likely constipated and you're probably not going to the bathroom adequately. But you're also not getting the other nutrients that are found in other foods. You're not going to get enough folate or enough calcium, or, you're going to set yourself up for certain deficiencies. And so it's important that we recognize that too.
Yeah. Yeah. Um, how about intermittent fasting?
That's a
How do
good
you feel
question.
about that? Thanks.
So intermittent fasting, there's a lot of definitions. I had someone come to me a couple of months ago who ate in a 2-hour window. I was like, what you do in those 2 hours? Just like scarf food down your face? Like, I don't understand how you eat in a 2-hour window. A, you cannot get all the nutrients your body needs in 2 hours. You're adding so much stress on your body to process food in 2 hours. It's going to cause a lot more elevations. And you're going to be nutrient deficient. You can't get it in 2 hours. There's intermittent fasting where you fast for 12 hours, you fast for 16 hours. That can be supportive in a heart healthy diet. But what I want people to always recognize is A, is it sustainable? And B, where's that timing happening? I don't know why there's this push in intermittent fasting theory is a lot of times people are like, don't eat until 12 o'clock. But then at 12 o'clock, you're starving. So once you start eating and you're starving, you can't satiate the appetite. So you're constantly eating, eating, eating. And now you added a large metabolic load on your body and it's struggling to process it. So what does it do? Blood pressure goes up, triglycerides go up, blood sugar levels go up. Your body can't digest that much food at one time and you're starving. We need to listen to our body. If you were to eat from 7 a.m. to 7 p.m., and you stopped at 7 p.m. and then you had a 12-hour fast, wonderful. You're going to get in all your nutrition. Your body is actually better at processing food earlier in the day because you're more insulin sensitive. So you can now process everything better. And then you give yourself ample time to digest before sleep. That's awesome. That's definitely going to be supportive of heart health, but the timing is imperative. And a lot of people are told not to be intuitive with when they're hungry, but rather follow a clock. And that's where we mess up when it comes to intermittent fasting. We want to make sure you're listening to your body, you're answering the hunger signals, but you're eating at normal hours where your body can digest it better because of better insulin production.
Yeah.
Where do you stand on breakfast as being the most important meal of the day? Some people say that's an old adage. Some people say that it still is important. And one of the arguments is that, well, if you don't eat before you start your busy day, you won't get some of the nutrition. So there's some practicality to it. What's your take on this?
Breakfast is super, super important. And it's important that you have a well balanced breakfast. So, enough protein, enough complex carbohydrates, enough heart healthy fats to start your day off with good, mental energy, but also so that you're continuously eating every 3 to 4 hours. So, your body is getting properly fueled and getting all the nutrients it needs. When you wait too long, a lot of times that means that you've had coffee. So you're having coffee on an empty stomach, which can increase cortisol levels, which can cause more of havoc on your immune system and on your stress levels, all these different things. So it's important to start your day off with breakfast. I would say all meals are important, but breakfast kind of sets the tone for the day, right? A lot of times when we don't have that breakfast, we're not really mentally attuned and we're not as productive. And, we might be a little more hangry, grouchy. It kind of sets the tone on that as well. So breakfast is important and we need to make sure that we're properly fueling our body. We live in such a fast-paced world that it's interesting that we have to teach our body again how to answer it and how to give it the nutrients that it needs. And we need to slow down to do that, but it will help us be more productive the rest of the day. For some people listening, they might say, I'm not hungry in the morning. And that's because you taught your body not to be hungry in the morning. You just had 7 to 8 hours, hopefully, of a fast. You need to break it in order to fuel your metabolism and get things moving. So maybe start with a snack and then you can make it into a bigger breakfast. But when people tell me that they usually don't wake up hungry and they're like, now, Michelle, I'm hungry in the morning. I'm like, yes, your metabolism is working for you. And that helps facilitate weight loss. We want to make sure that we're getting your metabolism to get started and fuel your body so that it can thrive.
That's interesting. There are some people that, of course, there are so many voices now speaking in favor of one way of addressing it or another. Some people say, well, fasting is a good idea, but at the same time, a dirty fast is a better idea, where because of the insulin sensitivity in the morning, you say within the 30-minute window after you wake up, you're most sensitive and protein is so important, then you're better off getting the 30 grams of protein that you can process within 30 minutes of waking up. But if I was to extrapolate from everything that we've heard from you so far, you would say that that's only a partial view of the nutrition, and you're missing a number of other nutrients that you should supplement into that initial meal, right?
So I like waking up within 30 minutes and eating within 30 minutes. I like that there's added protein, but I think a lot of times people are trying to make a name for themselves and they're like, only protein, only carbs, only this, only that. Everything matters.
Right.
Like, why are we being so like one is the thing, fame and game? Like, let's take care of every organ of your body. Let's give you all the nutrients you need. They all matter and they all matter in the right quantities. So I do think there's a small piece of that puzzle missing of don't just take a protein powder, put it in water and drink it and gulp it down 30 minutes. Like, A, is that enjoyable? No. Is it going to last forever? No. Is it something that you're gonna like? Who gets excited? Oh, I'm gonna drink my protein powder in water 30 minutes. Like that's disgusting. Food's enjoyable. Let's enjoy it. Like let it be
Interesting.
tasty, let it be fun, let it be. So
And
that's my take on
there are
it.
people that think that the Mediterranean diet, part of the health benefits from that is not just the foods you're eating, but the fact that you're taking the time to sit communally, and that's one of the reasons it's hard to recreate in a fast-paced environment because you're missing the social context of the Mediterranean diet as it's played out in Italy and Greece and,
Okay, but like take
other
a
parts
step
of the
back.
world.
Well, let's take a step back. You go out with a bunch of friends, you're eating, you're enjoying the time, you have taken your mind off of your work for a little bit. How much more clear are you the next day? How much more mentally focused are you the next day? It's almost like you had like a vacation because you're connecting, you're bonding, you're enjoying, you're laughing, you're not stressing for a moment. You can't stress the whole entire day. You can't be in work mode the whole entire day and be productive and efficient and everything you want. The fuel is going to help you do that. If you take 15 minutes, 30 minutes out of your day to eat your meals, I promise you, you'll be more happy, you'll be more energetic, and you'll also be more productive. You'll save time. And a lot of people don't realize that in this stressful mind, fast-paced environment. And it's crucial. We need to do that. I mean, if you look at the blue zones, right? The people who live the longest, are they rushing to eat their breakfast and their lunch and their dinner? I know people who skip lunch because they're working. And I'm like, so you're starving at dinner, you overeat, and then you have a lull at 3 p.m. And you're like, why am I so tired? So then you're like, I'm going to get some coffee at 3 p.m. When if you actually took a step back, if you ate a properly balanced lunch, you wouldn't need your 3 p.m. coffee.
Really
Fair
good
point.
point.
Fair
Fair
point.
point. Although I don't know if I can give up my 3 p.m. coffee, but I appreciate it. It sounds to me like the biggest point with seems to be just make sure that you're eating whole foods, a balanced diet, like a balanced nutrition, and not overdoing it in any one way. As someone who like I'm someone who tends to go on this intermittent fast for about 15 hours, and I'll usually break it, after lunch. And when you were talking about it, I felt like you were describing me. I'm like, yeah, I'm not hungry in the morning. I feel great. I actually, if I force myself to eat in the morning, which I usually do on the weekends with the kids, we have pancakes, I tend to feel really tired afterwards. So for me, I don't feel really hungry when I break the fast around 12 or 1 o'clock. I feel like, oh yeah, it's time to eat. And I eat. Would that still be consistent with this overall healthy outlook, as long as for me or for whoever we're talking about, they're still not overeating at those times because they don't feel like they've been denying themselves per se. They, when it comes time to eat, they're like, yeah, it's time to eat. And then they have a balanced meal then, and they still have 9 hours or so to get their meals in. Does that resonate? Or you're like, no, 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 you're kidding yourself.
If you can do that for the rest of your life, okay, it may work for you. My only thing is, a lot of times, like for instance, someone finds out they're diabetic. What do? They get rid of all the carbs in their diet. Then what happens? The next time they eat a carb, their body doesn't know what to do with it. So now it's going to raise blood sugar levels even more because you're not teaching your body how to work properly. You're removing the culprit. You're putting a Band-Aid. You're not kind of teaching it how to actually resolve the issue. And so when you have pancakes in the morning on a Sunday, your body's not used to it. It's like, what are you doing? Well, you don't eat until 12. I'm storing all the glycogen now, and now you're putting it in me. I'm confused. And
Exactly
so
what it feels
that's
like.
right. And so that's the issue. So if you can tell me every day for the rest of your life, you can eat at 12, you feel good, and you do that and you get all the nutrients that way, it could work for you. But I want you to also put on that hat of, you know what? Is this sustainable? Because if it's not sustainable, there's no point in doing it for 2 months or 3 months. What's that going to achieve? Nothing. You need to be thinking about this in the long haul. And that's the biggest component. And also quality of life, right? A lot of times people will come to me and say, I'm following a no oil, no fat diet at all. And I'm like, do you like eating at restaurants? Do you like going out with friends? I'm like, your quality of life matters here. And we need to also take that into the picture. And we need to make sure you're getting all of the nutrients. We need to be looking at this from a long viewpoint because that's the only way to protect your heart. And so if you tell me, nah, I can't do it, like I'm really sad, my quality of life, I can't hang out with my friends, I can't do this, we need to reevaluate the situation.
Yeah, makes sense.
Totally makes sense. Yeah, absolutely. Once again, I think I'm asking a redundant question, but there has been a push for I'm going to conserve my mental energy, and I'm not going to choose what I'm going to wear. I'm going to wear a t-shirt and jeans every day. And you see all of these newly minted CEOs doing that and so on and so forth. And that, of course, kind of translates into breakfast. Okay, so every morning I'm going to have an egg. You want me to have protein? Fine, I'll have an egg, hard-boiled egg or two every morning, and maybe a toast, and I'll pack it together, and I'll have it on the way to work or right as I get to work or before I leave. That idea of eggs every day, because I've had this conversation a couple of times with some patients and some friends. Well, eggs, great, protein. We want protein in the morning. What's your take on eggs every day?
Okay, so it's not a yes or no question. This always kind of
Okay,
goes
yeah.
back. So when we look at the research in the general population, someone who doesn't have any family history of heart disease, who has no cardiometabolic risk factors, just a general healthy, nothing with heart disease, if they include whole eggs a week, it can be part of a heart healthy
I thought you
diet.
were gonna say a day.
It could be part of a heart healthy diet when we also take into account the saturated fat allotment in your other foods that you're eating. But the reason why we flip flop so much is because 30% of the population is what we call LDL responders. And LDL responders are individuals who have a genetic component of heart disease in their genes, in their family history. And those people, when they have the egg yolk, it increases their cholesterol levels, and it also can cause more TMAO to be produced in their gut, leading to more progressive atherosclerosis. So depending on the person, if someone has had a cardiovascular event, if somebody has a strong family history of heart disease, if someone has a lipoprotein A gene, which is many people that I do see in my private practice, I do limit egg yolks to about 2 to 3 times for the whole week. But egg whites have no repercussion when it comes to the saturated fat or the choline or the taurine production. So that's where I'm a little more lenient, but the yolks I do limit.
How do you feel about
I
eating
think you were
cholesterol itself? Oh, sorry.
so the cholesterol, it's okay. So cholesterol is the same thing when it comes to the egg situation. The individuals who are LDL responders, if they have too much dietary cholesterol, it can impact their LDL, their ApoB, and it can also impact their TMAO production in the gut. It doesn't mean you need to avoid it. It just means we do need to limit it a little bit more restrictively in this subgroup of the population. I think you were getting at another question, though, about routine. You're saying, can I eat the same thing every single day? Is that okay? I think that was the basis of the question, but then it got derailed for a second. So to
Sure, sure.
answer that question, so we do want some variety in the diet because it helps to feed the gut microbiome. So let's say every day you had eggs, right? But then you made an egg omelet and you changed the vegetable component, or maybe you changed the fat that goes in the toast. So instead of just having a plain toast, you add a quarter avocado one day. The next day, you add 2 teaspoons of peanut butter, whatever it might be, and that gives you at least some variety. So a lot of people are creatures of habits. They want to just have the same thing, but maybe we change one element, because in order for the gut microbiome to get stronger and more diversified, we do need to have variety within our diet, but it doesn't need to be that extreme of variety. It just needs to have some variety in order to get there. And so I don't like having the same thing every day. We do need variety for our gut microbiome, for our heart health, but it can be slight changes to help with the transition.
Great.
Yeah, that's great.
Thank you. Thank you for that clarification, because that really ties it in to the microbiome. And we keep coming back to the microbiome for all of these reasons. And the fact that if we vary it, it's not just for our enjoyment, because, hard-boiled eggs every morning does get old pretty quickly. But it also feeds the microbiome, which goes into so many different, from bowel movements to pro-inflammation and so on and so forth.
Yeah. We have to let you go in a minute, but I was hoping to ask you one more question about the microbiome in particular. How do you feel about probiotics and prebiotics? I know it's not a one-size-fits-all question, but do you think that people should be taking probiotics? Is that something that you recommend, or just eat fermented foods and yogurts and stuff like that?
So there's different types of probiotic strains in our food supply. And when it comes to heart health, we actually see in the research that there's two specific strains that help to reduce inflammation associated with heart health from those probiotic strains. And they're found in different types of fermented foods. So we have L. rhamnose and we have L. plantarinum. And one of those are found in our fermented dairy. One of those are found in our fermented plant-based foods like our kimchi, our sauerkraut, fermented vegetables, tempeh, etc. And so we do want variety in what we eat. If someone tells me, Michelle, every time I eat beans, I get gassy, or every time I eat cruciferous vegetables, I get bloated, that's a sign to me that they don't have the good gut bacteria to help digest those foods. And in those individuals, I will recommend a wide spectrum probiotic that's super efficient and potent for 30 to 60 days to help. And that will usually help repopulate it. But in someone who doesn't have bloating, distension, doesn't have that excess gas, and they are open to eating more of these foods, we will add them to their diet so they can get it naturally in order for it to be better utilized.
Excellent. Great. Excellent.
I think you've been very generous with your time,
Yeah, you've been great.
and we know that we have to let you go. So this
This was fantastic. Yeah, we
Yeah,
have to let you go
absolutely.
help others
Sure.
with cardiac stuff. Thank you so much for taking the time. This has been really illuminating. Um, I'm
And before we let you go, where can people find you?
You can find me on my website at entirelynourished.com. You can also find me on Instagram at heart.health.nutritionist. I'd be happy to have you on my email list where you can get heart disease prevention tips straight to your inbox as well. Thanks for having me.
Perfect.
fantastic. Thank you so much.
Thank you.
Friends, thank you for your attention. We hope you've enjoyed the conversation. If you find value, please remember to hit the like button, help us with our YouTube algorithm. Consider subscribing to the channel and turn on the notifications so you can stay up to date with everything going on with the channel. And please leave us a comment, let us know what you thought about the show and also what you'd like to hear about in the future.